Do you have high blood pressure and wonder how much does salt affect your risk for high blood pressure? Well, think of salt like a magnet and water is like metal shavings. And so with the magnet, it's going to attract the metal shavings in. And so with salt, it's drawing water in. And so with high blood pressure, one of the things that can happen is if you're one of the many Americans who has too much salt in the diet, sodium and chloride, although it's mainly the sodium that's the problem, then you're attracting water into the blood vessels. You're increasing that blood volume, and then you're putting pressure inside the blood vessels. And that's what high blood pressure is. It's that force that's occurring inside the blood vessels. Now, you may not know that 9 out of 10 Americans consume too much sodium. It's recommended that people do not consume more than 2,300 milligrams a day. Now, there are exceptions to that. If you're a competitive athlete, if you do a lot of training, you're sweating a lot, you work outside a lot, then obviously you need more. But for most people, they don't need more than 2,300 milligrams. And actually, studies show that even 1,500 milligrams for a lot of people will be even better. But the average American consumes 3,400 milligrams a day. So you really don't need more than 1,500. Most people are getting double that amount. And so you can see how that's going to draw water into the blood vessels. And there's other things that are happening hormonally in the body. You have a system in the body where essentially when you're getting increased pressure, increased salt, there's different hormonal messengers that occur, and that leads to blood vessel constriction. So now about 65% of sodium comes from packaged foods bought in stores, and about 25% of people's sodium comes from restaurants. So right there, that tells you something. When you're shopping, you've got to be buying the fresh, unprocessed foods as much as possible, and being careful when you're eating out at restaurants, because right there, that's 90% of your salt intake. Only about 10% is from the cooking that occurs from home. And so you can see with so many Americans eating processed foods, eating out at restaurants so commonly, that they're getting a tremendous excess in sodium. The most recent research published in the Journal of the American Medical Association showed that a low sodium diet, about 1,300 milligrams a day, can reduce blood pressure in the majority of middle-aged to elderly adults. So that's good news. That's showing just changing that sodium in the diet down to about 1,300 milligrams a day can make a big difference. And so in that study, there was a drop in about 6 points or 6 millimeters of mercury to be technical. And that's enough for a lot of people to get them out of that high blood pressure range. We see a lot of patients who are in that grade 1 hypertension, the beginning stage of high blood pressure. And so if you want the first number, the systolic blood pressure, to be less than 130 and the second one to be below 90, for a lot of people, they're kind of borderline, and just making that difference in the sodium intake can get them out of the high blood pressure. Also, for people on medications, there's a lot of people who are on more than just one medication for hypertension. And so with that salt reduction in the diet, that can make a difference between needing one medication or 2 or 3 medications. So it can be very effective. Now, in the study, there's more to the story because these participants were actually given prepared meals. And in those meals, they were getting 4,500 milligrams of potassium and 1,000 milligrams of calcium. Now, we know that most Americans do not consume enough potassium and calcium in their diets. And there's been studies done which show both of these minerals do reduce blood pressure. So it's important that you not only reduce the salt, the sodium, but that you also increase the potassium and the calcium. Now, there are some medical conditions like chronic kidney disease and some other ones where you've got to be careful with the amount of especially potassium that you're getting. So if you have a medical condition, obviously check with your doctor. But for most people, they need less sodium and they need more potassium and more calcium in your diet. Now, there's been other studies done on salt, a very large one done in 1998 called the INTERSALT study. This was unique because it involved over 10,000 men and women aged 20 to 59 from 32 different countries, and it included the United States and Canada. And what the researchers did was they looked at the relationship between the urine excretion of electrolytes, such as sodium, potassium, and blood pressure. And they found that high urinary sodium excretion, meaning you're getting more sodium in the diet, and lower urinary potassium excretion, meaning you're not getting enough potassium in the diet, were associated with high blood pressure. And even more so, like the ratio between the potassium and the sodium was very important in predicting high blood pressure. You should know that there's a very well-studied diet for people with high blood pressure called the DASH diet, and that's the dietary approach to systolic hypertension. And so in this diet, you're going to get a diet that's lower in sodium and high in potassium, getting that ratio you need to help with blood pressure. And it's a diet that has fruits, whole grains, fat-free or low-fat dairy products, fish, poultry, beans, nuts, and they limit foods such as fatty meats, full-fat dairy products, certain oils like palm oils, as well as sugar-sweetened beverages and sweets. Now, you should know that the DASH diet, when you analyze realize that it is rich in, yes, potassium, calcium, but also magnesium. And magnesium is a great mineral for lowering blood pressure too. And we know about 70% of Americans do not get enough magnesium in your diet. Also, the DASH diet is high in fiber and protein. So that means it's not going to be spiking insulin levels, which also can lead to high blood pressure. So in the DASH diet, the average sodium intake is about 2,300 milligrams. But we know that in other studies, when you get that level down with the DASH diet to 1,500 milligrams, the blood pressure responds even better. Now, just as kind of an idea of how much, salt you get in terms of a serving, a teaspoon of table salt contains about 2,300 milligrams of sodium. Now, if you like to cook a lot at home, which is the best thing to do because, again, most people are getting their excess sodium from eating out or buying packaged food. So if you're making fresh foods at home, that's the best. But we know that you can use salt substitutes. So these are salt substitutes that contain potassium chloride. Tastes similar to salt. I wouldn't say exactly the same, but it's something that people get used to. And that's something you can use if you cook a lot at home and you like to add salt to your food. So we should know that in terms of the diet, where do people get most of their sodium from? Well, they actually have studied this. And the majority of sodium comes from processed foods. So these will include foods such as deli meat sandwiches, pizza, burritos and tacos, soups, savory snacks like chips, crackers, popcorn, poultry like chicken, pasta mixed dishes, burgers, and then egg dishes, which tend to be high in sodium. The average person can survive on 500 milligrams a day of sodium. I'm not advising you use a diet that low, but it goes to show you that you don't need near as much sodium as people are getting in their diet. And for potassium, because again, you want the higher potassium and the lower sodium in the diet, adult males should be getting about 3,400 milligrams of potassium, females 2,600 milligrams. And for calcium for adults, males about 1,000 milligrams and females 1,200 milligrams. Now, why is this important? Well, studies show that the average American adult, and child for that matter, does not meet the daily requirements for both potassium and calcium. And so if you're not getting enough of these foods, it's going to contribute to your high blood pressure. Well, there you have it. There is a connection between sodium and your blood pressure. But the more important point is lowering the sodium, the salt in the diet, but increasing the foods rich in potassium. That combination works much better than just reducing sodium by itself.